have we really flattened the COVID-19 curve? Let's find out from infectious disease expert Dr. Benjamin Ko. Dr. Ko, thank you so much for joining us on The Final Word. Does it make sense for Secretary Duque to use April data, that's what, 3 months ago, to say that we have flattened the curve?
Hi, good evening, Rico. Well, I guess I think Secretary Duque has released a statement that he did not mean actually that the curve was flattened, if I am not mistaken. He just released that a few hours ago after saying that the curve was actually flattened. So, in fairness to him...
But shouldn't he be honest with the public and not mislead them that we have flattened the curve from data in April?
Well, let's make it clear this way. In medical parlance, when we say the curve is flattened, we refer to various isolation measures in the community that help keep the daily number of cases of disease at a manageable level for the medical providers. And essentially, there are two parameters that we normally use, the Center for Disease Control in the U.S. uses, to say that the curve has been flattened. Like, number one, and the most important, well, not in the order, is a slow acceleration in the number of cases, which obviously is not the case. That there is no acceleration in the number of cases. We've had reports of a few cases a day, a few hundred cases a day, and then suddenly it spikes up to 1,000. And the last week we've been seeing it in the 2,000 number. So definitely based on the first criteria, we don't belong there. The second criteria is a reduction in the peak number of cases and the related demands on the hospital and infrastructure. And I think what he refers to, and I may be wrong, no? What he refers to is the general healthcare capacity of the country. But the general healthcare capacity of the country, which means the total number of beds that are available, is still at more than 50 to 60%, is a diluted information because it provides you a general overview of the whole Philippines. But if you look at where the epicenters are, which is the National Capital Region, which is in Cebu, we can tell that the statistics are different because more than 70 to 75% of the hospitals are filled in these areas.
So, Doctor, personally, with the data that we have right now, are we far from flattening the curve?
We still have a lot of work to do at flattening the curve. In terms of, well, to answer the question bluntly, yes, we are. You see, from whatever measure, while we were able to slow it down during the enhanced community quarantine, the relaxing phase was partially responsible for the increase in cases. Why? Because when we started to relax the quarantine, that is when we started instituting the testing capacity. I'm sure everybody knows that the testing capacity came late, and our isolation and quarantine facilities were not being utilized until today, when we are now at odds with having to isolate those that are affected in the community. So these two important mitigation strategies should have been done together when the ECQ was implemented. What I'm saying is a lot of things should have been done during the early stages of the pandemic so that we would not have come to this point.
Well, that's why President Duterte has appointed several more czars to take care of treating, tracing, isolation. And currently, Doctor, when we spoke to each other last week, you mentioned that by the end of July and by the first week of August, we could reach 100,000 infections. Are we still on track with 58,000 cases halfway through the month of July?
Well, definitely, we're on track with the 60,000. So the 60,000 we will breach before the end of the week, unless the numbers go down. Even if the numbers go down, we will mark the 60,000 sometime this week or next week. Our 7-day average is at around 1,300 to 1,400 cases as of today. So if you multiply that by the total number of days we have left in the month of July, which is around 16 more days, then more or less you have, and I'm just talking about a constant amount. I'm not even talking about a moving amount. But if you kept the numbers constant at that 7-day average, then you have your total, around 80, 90, 100,000, depending on how we address also some of the backlogs. Because if you notice that some of the testing facilities, like the Research Institute for Tropical Medicine, once upon a time has been averaging less than 7-8% positivity rate a day. Yesterday, I looked at the data of the DOH, and they had 30% positivity rate just for the day. So 3 out of every 10 patients that get tested at the reference laboratory, which is RITM, turn out positive.
So we can still expect grim numbers over the next 15 days of July. Thank you so much for joining us, Dr. Benjamin Ko, Infectious Disease Expert.